Millions of people are at risk of hunger because of the COVID-19 pandemic. Even in the US and Europe, more and more individuals are relying on food handouts just to get by, as the coronavirus crisis hits their livelihoods.
I have to come to these places so that my daughters can eat. It's what saves me.
And while the disease doesn't discriminate, the way it impacts disadvantaged people reveals society's inequalities. This is DW's COVID-19 special. I'm Janelle Dumalaon. The pandemic has erased years of economic progress in many countries, like in Spain. The country is in its worst recession in more than 80 years, and that's weighing most heavily on its people.
Seemingly endless queues for food in Madrid's working-class district of Vallecas. Some people have been regulars at this food bank at a church for years, but others are new. The pandemic has brought them here. Some are too ashamed, they hide from the camera, so others speak for them. There are people here who have been waiting to get minimum state subsidies for ages. There are people who applied for furlough in March and still haven't been paid. Hit by one of Europe's worst coronavirus outbreaks, Spain's economy has been left shattered. People on low incomes, migrants and casual workers have suffered the most. Nuria worked as a hairdresser for the past 17 years. That was until the pandemic. Now she, her husband and their 5 children have hit rock bottom. We were not made of money before, but we always had food. Never in our lives did we imagine we'd end up like this. Nuria was entitled to apply for furlough payments, but she has had to wait too long for the money to come through. They should think about the families who don't have food. Please don't forget us. The system is at a standstill and our situation is very bad. The government says it will extend the furlough scheme. It has rolled out a basic income program, but the process of getting benefits is highly bureaucratic and lengthy.
And even with the money, food donations remain essential. Demand is soaring. Many people are falling through the cracks and have little to no financial aid.
The Spanish Food Bank Federation's latest figures show just how many people now depend on their help. In the first part of the pandemic, we had 1 million beneficiaries. Now we're looking at 1,890,000. Their warehouse on the outskirts of Madrid supplies 70,000 kilos of food every day. That's mainly paid for by government and EU aid. These schemes have been extended, and a recent campaign for donations should ensure that the warehouse doesn't run out of stock. Back at the church, Father Gonzalo needs more volunteers to fill the many trolleys and reduce waiting times. They go from empty to full within seconds before they get to the waiting hungry. I confess that on some days during the pandemic I thought I'd not make it home. I was walking at the speed of a person who had aged 40 years. But that doesn't stop him. One full trolley contains food supplies for a month, including treats that families cannot now afford. When the children see the cocoa or chocolates, they're very happy. Because I can only buy the essentials. The pandemic has hit Spain's already battered economy hard. It's unlikely it will recover quickly enough, so people may have to rely on food handouts for some time to come.
Now, as we saw in the report there, the coronavirus pandemic has pushed many around the world into economic hardship. Now we want to look at the link between the coronavirus and social inequality. Here to help shed light on that is Nico Dragano. He is a professor from the Institute of Medical Sociology at Heinrich Heine University in Düsseldorf. Welcome to you. Now, your research has focused on how social phenomena like poverty affect one on a biological level. What has the coronavirus taught you about COVID-19 and existing economic divides?
It shows us that even the corona pandemic has a social inequalities dimension, when we look at the epidemiological data, we see that poorer people or poorer countries or poorer areas face a higher burden of infections. And we also performed some studies on severity of disease and found that poor people have a higher risk to have a severe cause of the disease when getting infected. So we clearly see a social gradient in the corona pandemic.
So basically, we're looking at a situation where if you're poor, you're already more at risk for the virus. And if you do get the virus, you may face even more economic pain. Is there a health policy answer to that kind of vicious circle?
So that's hard to answer because this is a structural problem. We see health inequalities in nearly each disease we studied. So we see it in cardiovascular diseases, we see it in psychological diseases. It's always there, and we haven't found a proper response yet. I guess it's quite important to notice that and to think strategically, how can we handle this problem in the acute pandemic, in the situation we are into now. But we need a long-term strategy to reduce health inequalities in all diseases in the long run.
But given these long existing inequalities in society, how would a strategic handling that you speak of, how would that look like in practical terms?
So I guess the WHO, the World Health Organization, gave us some good advices. So there's a strategy called Health in All Policies. That means that the countries should implement ideas and strategies to improve health in all the policies, and in particular to think about health inequalities in this context. For instance, when you look at educational policies or at tax policies, where the root of the inequalities lie, you should consider that. And you need to implement this kind of thinking and this kind of strategy in all the policies which shape the social determinants of health. So there are some ideas, but we need to implement them.
Can you give us any examples of strategies that one can employ in order to integrate the social component in fighting the pandemic?
What seemed to be promising, in my view, is to focus on area and neighborhoods, because there you can have the participation of the people who are mostly affected, and you can change things. For instance, here in Germany, we observed that during the first wave of the pandemic, many structures which help poor people were closed. So they started to find new ways, for instance, online counseling, or they worked they opened certain facilities only for children from disadvantaged families. And I guess this focus on areas, neighborhoods, and local communities can be one chance to react quickly in the moment.
Thank you very much. Nico Giordano there for us. He is a professor from the Institute of Medical Sociology at Heinrich Heine University in Düsseldorf. Thank you very much for your insights.
Thank you.
And now we come to that part of the show devoted to one of your sent-in questions about the coronavirus. Our science correspondent, Derek Williams, has an answer for you.
After you receive a vaccination for COVID-19, can you still transmit the virus to others?
The short answer to this is that we still don't know at the moment, but it's an issue that both drug developers and healthcare authorities have on their radar. Trials appear to have shown 90% or higher efficacy with at least 3 candidates so far. That means that after tens of thousands of test subjects were given either the vaccine candidate or a placebo, 9 out of 10 people who later caught COVID-19 were those who had been given the placebo. And importantly, at least with one candidate, vaccinated subjects who subsequently caught the disease, they only had mild symptoms. That indicates that vaccines can have positive effects even if they don't prevent infection completely. And that really touches on the crux of this question. We somehow have the idea that it's all or nothing with vaccines. I mean, either they protect you or they don't, right? Well, wrong. It's actually better to think about it more like a sliding scale. Remember, in trials, around 1 in 10 people who contracted COVID-19 later had actually received the vaccine, and they might well have been infectious. Maybe others were as well. And that's down to how powerful the immune response is and whether or not it can provide what doctors call sterilizing immunity, which is whether the body can wipe out the virus before it really starts to replicate. If a vaccine doesn't prevent the virus from replicating, but just neutralizes or mitigates the effects of the disease, then at least some vaccinated people could, in theory, still spread it. How many and how often, we don't know yet, but experts are hopeful we'll have a better idea in the next few months.